This is episode 96 of the Real World Wellness Podcast. Hi everyone, I'm Christine Lehman, a nutritional therapy practitioner and the reverse diabetes coach, which is also the name of my website. I see clients in person and remotely via Skype. You can reach me through my website, again, reversediabetescoach.com. Please remember while you're listening to the show, advice and information we provide is intended to be helpful and informative, but is not a substitute for medical advice or treatment. So today is the fourth installment on a new series on how to have healthy hormones during perimenopause. And so far, we have presented an overview and estrogen dominance, the impact of stress on your hormones, and now we're discussing natural remedies focusing primarily on herbs. So I'm very pleased to have Ann Melin with us today to talk about this topic. And to introduce Ann, she is a clinical nutritionist and a holistic health practitioner specializing in restoring functional health and balancing common dysfunctions in the hormone, immune, digestion, and detoxification systems. Her passion for natural and holistic health began nearly 25 years ago when, as a teenager, she bought her first book on the healing properties of plants, attended her first yoga class, and participated in a series of mindfulness meditation classes. Several years later, when Anne suffered her own health challenges, those struggles deepened her interest in restoring health by using natural healing modalities. Through her healing process, she touched into a core value of wanting to share this work with others by helping to support them through their own personal health journeys. Ann is the owner of Upward Spiral Nutrition and Wellness, and her website is simply annmelin.com, and I'll share that URL again in the show notes. Welcome, Ann.
Hi, Christine. Thanks for having me.
Oh, my pleasure. So maybe you can just tell us where you're located and a little bit more about your herbal training.
Sure. So I am actually currently located in central Vermont in the middle of the woods, about 15 minutes outside of downtown Montpelier. So it's absolutely stunning and beautiful here, and I really believe in the power of the woods and nature to help restore health. So I am just thrilled to be here. My background and training as an herbalist, it had been really a long progression for me in terms of doing a lot of my own self-study and a lot of work on myself, but I was formally trained in Encinitas, California, at a school there called the Natural Healing Institute, and I went through several of their programs. I went through their nutrition program, through their clinical herbalism program, through their massage program, I did a lot of study out there with them for quite a long period of time. I've also trained through the Functional Diagnostic Nutrition program online. I'm actually their primary clinical advisor and lead mentor now, so I've been with them for several years now. And so part of my specialty also involves, in conjunction with the study of traditional herbalism and how to use herbs, is also that functional piece and looking at functional lab work and testing and that kind of thing to help guide that process. So I think what's a little bit unique about me and my practice is that I integrate this very kind of old traditional field of herbalism in a way, but within a more modern context, using the technical tools that we have available to us through modern lab testing.
Mm-hmm. Well, that's a great segue into talking about tests related to perimenopause. And just to refresh my listeners' memory, perimenopause is the stage preceding menopause, and it can last anywhere from a few years to several years. So we know this is a time of big hormonal fluctuations. So I was wondering if you can just give us an overview about what tests you might use, in your own practice when a woman who's undergoing perimenopause or even menopause comes to you.
With almost all of my clients, I think that it's useful to have a look at hormone testing in general. I would imagine that A lot of people who are listening to podcasts out there and stuff on hormones are probably familiar with the Dutch test, but if not, it stands for dried urine testing for comprehensive hormones from a company called Precision Analytical. That's usually my starting point for hormones as a functional practitioner. It in a lot of ways is very similar to a traditional, what you would call sort of extended adrenal panel that a lot of people have traditionally done and labs have traditionally ordered done through saliva testing. This particular test uses dried urine samples, and while saliva has been very useful for checking cortisol levels and adrenal hormone levels, it's less precise when it comes to actually evaluating female hormones and sex hormones. So the urine testing is really wonderful for that, and this dried urine testing is capable of showing any number of different things that were commonly unavailable on saliva panels. So it gives us a look at the adrenal hormones, at the cortisol and DHEA, which are really important because I think so much of the time some of the problems that women experience during perimenopause are related to stress. So the more stressed out you are, the worse your perimenopausal symptoms are probably going to be. But then that test also gives insight into all three estrogens, progesterone, estrogen metabolites, testosterone, metabolites of testosterone and DHEA, how well you're metabolizing estrogen, and how well you're methylating that, so we get some insight into detoxification and how well the body's clearing hormones or not. And that can also then give me insights and pointers into any number of different other areas that may be involved in that, like the gut, like the thyroid. So a lot of times there is a combination of complex factors that are interacting together to create a more challenging set of symptoms for clients than might just be, I don't think it's, most of the time, I don't think it's only about, estrogen or progesterone or both are dropping, right? There's usually more at hand than that, at least in the clients that I work with. So that's kind of my initial go-to test, and from there I'll commonly do some additional testing based upon some of those pointers that I'm getting.
So what additional tests might you use?
So thyroid testing a lot of the time is something that needs to be done. There's so many women out there for whatever reasons who have either undiagnosed or improperly managed thyroid problems. I would say about 50% of my female clients come to me already diagnosed with a thyroid issue, but they've never had their antibody levels tested. They've never had reverse T3 tested. They're being medicated, but they're only having TSH monitored, or maybe TSH, T3, T4, but not comprehensive thyroid panel. And that can give you some really different insights when you start seeing, is this an autoimmune driven issue, or is it a primary thyroid issue? Because then you need to start looking at that situation differently. So that's one thing. And then also doing gut testing, because that's quite commonly another factor too, especially when women appear, to me, to look really depleted, especially if they're kind of on the, as we're looking at women in perimenopause, late 40s, early 50s. So at a time, sometimes I'll see these women coming through and their hormone profiles look like those of what I would expect an 80-year-old woman's to look like. And so we really shouldn't be that depleted at that stage, right? So usually that would indicate to me that there's improper absorption or inflammation or something like that going on in the gut, infection. So I'll look for that as well.
So when you say depleted, what do you mean?
So commonly, what I see are women with GI infections that then impairs absorption of nutrients. So that's another thing. Sometimes I'll look at nutrient status through micronutrient panels to see, is there adequate or sufficient absorption of minerals and nutrients. So a lot of people might be eating a really healthy diet, or a lot of people may not be, depending, right? But even if they're eating a healthy diet, if their gut's impaired significantly enough, they may not be absorbing the nutrients they need from those foods.
Right. Yeah, I use an autoimmune protocol, and I also use a paleo type approach, ancestral approach to detox people, and then sometimes I go further with the autoimmune protocol to figure out what their inflammatory triggers are.
Yeah.
Because inflammation plays a big role, I would think, certainly in autoimmune conditions. So.
Yeah, absolutely. And I think in a lot of the sort of more chronic conditions that people have, inflammation is such a driving factor. And so frequently, I mean, food is definitely a huge part of it. I mean, most of us grew up eating a less than optimal diet these days, and then now kind of as we start getting into our 40s and 50s, that's when we start really feeling the impact of that frequently. And then you throw in all these hormonal changes on top of that, and suddenly it's kind of a perfect storm for a whole set of symptoms. And I think too, I mean, one of the things I see so frequently is infection also. And so it may appear that there are a lot of food sensitivities, but that can be a result of having some kind of chronic infection present. And that can drive autoimmune processes as well. So I always think it's important to look for that too when I get indicators that that's a possibility.
Yeah, that raises an interesting question about there's all types of infections, right? They're bacterial, they're viral, and also, frankly, some of them are GYN related. So yeast infections are common. I'm wondering, is there a particular types that you're seeing that are more common than others?
Yeah, so I mean, you talk about yeast infections, and most of the time if women are having frequent or recurrent yeast infections vaginally, then there is also a more systemic yeast problem going on. So, and a lot of times that can be driven. We know about, that sugars and refined carbohydrates and those kinds of things feed yeast, but also imbalances of beneficial microflora. So, even doctors now are even doctors, that's a terrible thing to say, but, we'll recommend, take some probiotics,
right.
eat some yogurt, they say, when you're taking antibiotics or whatever, because once your beneficial bacteria dies off, that it's a great place for yeast to grow up. But also if the gut's otherwise compromised, if there are other infections, so parasitic infections, other types of bacterial infections like H. pylori, say, or small intestinal bacterial overgrowth, those kinds of things can create an environment that's really conducive to an opportunistic organism like yeast growing. So a lot of the time, I think that we need to look for what's the more primary infection, and we need to deal with that first if we're really going to get to it. So yeah, I mean, and even, urinary tract infections and that kind of thing, a lot of times are bacterially driven, and if you start looking into the gut, you'll find overgrowths of those bacteria that are kind of fueling urinary tract infections as well. So, yeah, I mean, there's this balance, right, between doing the necessary relief care to alleviate a lot of these really troublesome symptoms and make sure that infections don't spread too rampantly, like with urinary tract infections. That can become really dangerous. And then also getting to the more kind of primary causal factors as well.
Do you work with GYNs?
I am not currently in collaboration with any. So I moved out here to Vermont from California just last summer. I did have a couple of midwives and that kind of thing in California who I was in connection with, but and naturopathic doctors, but I'm not as integrated here in Vermont at this point. So.
Yeah, I was just curious. I would think it would probably be a better fit if they were integrative, right?
Yeah, for sure.
Yeah. So, speaking of sort of conventional versus natural treatment, why don't we talk about some of the symptoms first of perimenopause? Certainly, I've read that common symptoms are night sweats, fatigue, anxiety, hot flashes, vaginal dryness, and so on. So do you want to just pick a few of these and talk about how you would approach it?
Yeah, so let's start with the hot flashes and night sweats, because a lot of times that's one of the most primary symptoms that women will complain about, because it'll impact them in any number of different ways, or at least that, I get a lot of women complaining about that. So it's an interesting thing. Hot flashes arise as a result, quite commonly, of if there's a lack of ovulation, and if estrogen isn't surging the way that it ought to be, the body's going to keep stimulating follicle-stimulating hormone. It's going to keep producing that, because that's the feedback loop for shutting that off is estrogen. So if you're not producing enough estrogen, you're going to keep producing more follicle-stimulating hormone. And that's a vasodilator, so you can wind up with hot flashes as a result. It also will surge adrenaline. So this is where I think that is an important link back to stress, because adrenaline's an adrenal hormone. And so adrenaline will then also cause a consequent surge of cortisol levels and those kinds of things. So if your stress response is already out of balance, then you hit menopause, and then this whole cycle is going to make that even worse. So I do kind of want to throw out a disclaimer, just in that we just talked about testing. And so I will talk about some herbs and some things that I've used that I've found to be really helpful with hot flashes and night sweats and that kind of thing. However, I do just want to emphasize that I think testing is really important, because most of these herbs that I'm going to talk about are going to have some kind of modulating or regulating effect on hormones. And one of the tricks with perimenopause is that it's really easy to think that the hormone levels are dropping. But I have seen several cases where I've actually seen estrogen levels rise as progesterone levels drop.
Right.
And so some of these herbs can actually push estrogen even higher, or in some people can do that. So I just kind of want to emphasize the importance of knowing what your hormone levels are before you just start throwing herbs and stuff at yourself, trying to manage your symptoms. Certainly, you're welcome to do whatever you want with your own bodies, but I just sort of feel like as a practitioner, it's my responsibility to say that.
Right, and I think that's best practice. I'm big on, you and I are both holistic and functional medicine approach philosophy, so and approaches. So what that means is we want to get to the root cause, and in order to do that, it involves usually a very solid, comprehensive evaluation, which can include tests. So I think it's very important to do that, to know what you're dealing with, and to have the data.
Yeah.
And I do that with my clients, and also to know what else they're taking, because, and you can talk about this briefly, if they're on medications, that's very important to know, well.
If you're on a medication?
If your client is on a medication, you need that, to know that, just in case there's some herbal drug interaction, right? Right.
Yeah, absolutely. And so that's another thing to be aware of. So, and I'll kind of mention it as I go through some of these things, but also if there is something like an autoimmune condition, some of these herbs also have impacts on the immune system. And so sometimes that can be beneficial, and sometimes it can be more harmful if there's an autoimmune condition present. So those are other things where it's kind of important to know what you're doing with some of these things, and also know what's happening with your own body. So, I think one of the most common formulas that I've used that I've found to be really helpful with hot flashes and night sweats is a combination of black cohosh, which actually, it used to be thought of as a phytoestrogen, but it's not a true phytoestrogen, although it can impact estrogen levels. It tends to be safer than a lot of the more intensive phytoestrogenic herbs like red clover, in that it's more tonifying and balancing. So it'll have a more regulating effect on estrogen rather than being stimulating or suppressing like some other things are. So it can impact luteinizing hormone levels and overall be kind of balancing in that way. Vitex is another one that supports progesterone levels. So most commonly, I see progesterone on the decline in perimenopausal women. Very rarely will I see progesterone elevated or even surging as we would expect it to be in premenopausal women during the luteal phase of their menstrual cycle. And so Vitex will usually stimulate progesterone production, and just keeping the hormones more balanced and offsetting estrogen dominance can help with some of the hot flashing. Skullcap is a great herb actually for clearing heat and inflammation. So as we come back to that inflammation piece, this is a great thing to kind of throw into a blend like this. Sage is another great herb, reduces sweating generally. You know, you think about sage being a desert plant, right? So it can have this impact on helping to reduce sweating and heat also. And then motherwort is also cooling and can calm heart palpitations and that kind of thing that commonly go along with hot flashes. Motherwort's one of those herbs, though, to be aware of and cautious about if you have autoimmune conditions. So that's a blend that I'll typically use with women who are having hot flashes, and does seem to work pretty well to that end, as long as there's not a lot of other kind of severe issues going on.
Can I ask you a quick question? For motherwort,
sure.
I happen to have an irregular heartbeat. So is there any precaution one should take before taking motherwort, such as that?
So, I think it could actually be, well, when you say irregular heartbeat, I guess I would want to know more about that, because motherwort can be beneficial for heart palpitations or racing heart. I might pair it in somebody with a heart condition with something like hawthorn, which is a really great remedy for heart conditions in general and a great tonic for the heart. So that way you could get even more of an overall benefit for the heart and the cardiovascular system in general.
Yeah, I have it's normal, but it's just irregular. It's arrhythmia. That's what the medical term is.
Yeah, I don't think that motherwort would be harmful for that at all. You know, with everything though, right? So this is where putting out kind of blanket things about, oh, here's a really great remedy.
Right.
I always come back to, okay, we need to look at this from an individual perspective. And even then, when I'm looking at talking to somebody, getting their history, looking at their labs, I still don't know how each individual is going to respond. So if you do choose to try any of these herbs or anything, I would recommend trying them in a small amount, listening to your body, paying attention, watching how you react, right? And then if you find you're okay with it, you can gradually increase the amounts. Or if you find you're not okay with it, then you go, okay, I know this is not a good herb for me, right? So I think we all kind of have to learn to pay attention to ourselves in that way too.
Absolutely. I think that's wise, even on medication, to just try a small amount. That's why I take it at night, just to see how I react, because that way if I have any adverse reaction, it's not going to affect my day too much. So you mentioned the word blend. So can you explain that? How would one get a blend of these different herbs?
Sure. So this kind of depends, and I do it in two different ways depending upon the client and what they can do and what they can't do. I mean, there are a few different ways to do it. There are two ways that I prefer. So herbs have kind of good, better, and best sort of ways that they can be distributed to, and ingested. So the best way to really pull medicinal constituents from herbs is to actually do it in an alcohol tincture. So that has the best impact in terms of drawing out the heavier, more medicinal qualities. So you'll find a lot of tinctures that, there are some pretty good brands that you could find at like any Whole Foods, essentially, like Herb Farm, that's PHARM, Gaia Herbs will carry a lot of these, and most of them will be individual herbs that have been tinctured. So you might find a black cohosh root tincture, right? And then you might find a motherwort tincture and a vitex tincture. And then what I'll often recommend clients do is buy individual ones of each of those, and then I'll have them mix them together in certain ratios depending upon what their lab results show, what their particular symptoms are, and what they're struggling with. So a lot of times I might do like 8 parts vitex to 4 parts black cohosh to 3 parts skullcap, 3 parts sage, 2 parts motherwort, something like that. But it'll vary depending upon the client. So that's kind of just a baseline, but I definitely do it differently depending upon what the individual client's showing. The other way to do it that I do a lot with people and that I like is as a tea. But it takes a certain willingness and organization to do them as teas. With the tinctures, it's easy. You can kind of mix them all together once you have your ratios established and you know you're handling each individual herb well, and then you can make the blend and you can just carry a little bottle around of that with you. With the teas, it requires quite a lot more preparation. But there are some interesting things about the teas. They also generally taste terrible unless you like real bitter, earthy flavors. And so a lot of people have trouble tolerating the taste of them, but one of the interesting things about really tasting them like that is that it does send information to the brain about what herbs you're taking. And what their constituents are, and then it starts to have an impact right away based upon those tastes. So it starts stimulating hormone production and neurotransmitter firing and all of that, so your body starts responding. Just like the more you chew your food, the more information you get about the nutrients that your body's about to get. Same thing with the herbs. The other thing is that the reason why I like these 2 forms is that they're liquid forms, so they're going to be more readily absorbed. And that can be really beneficial too, especially if there are issues with absorption and assimilation and all of that, as is the case with many women who I work with.
So are the I'm sorry.
Yeah, no, go ahead.
Are the teas then absorbed faster? Is that the difference? You mentioned, how your system responds quickly versus the tinctures.
I wouldn't say the teas are necessarily absorbed faster. I think that you're just getting more information. You'll still get some of the taste of the herbs through a tincture, but oftentimes it's going to be so impacted by the grain alcohol that's used in that really like hefty alcohol-y flavor mixed in with all the bitterness that I think it just taints the quality of the taste response a little bit.
I see.
But the drawing of the medicinal constituents from water isn't as powerful as the drawing of those constituents in alcohol. So there's always a weighing of those things as well, and looking at sometimes that for me, honestly, I don't have I don't have a good answer as to how I decide which way to go with particular clients. Sometimes it's more of an intuitive thing that will drive me to recommend one thing for a client over another with regards to what form they take it in. Certainly there are plenty of other encapsulated things that people can take too, and that for me with herbs is a last resort if I have clients who just can't handle the intensity of the tastes, or if it's just too much for them. Some clients are really easily overwhelmed. And doing the tinctures and carrying those around and mixing herbs together, it's too much for them. So then I say, okay. And one of the nice things, Gaia Herbs, actually, they do a great job because they tincture herbs and then they burn off the alcohol and encapsulate them into gel caps. So you wind up, they have encapsulated versions of a lot of herbs that are really potent as compared to a lot of sort of more of the powdered herbs that are encapsulated from other brands. The only thing to be aware of with most of the Gaia Herbs products is that their capsules have some soy in them. So usually I find it's not enough to be really problematic unless somebody's really reactive to soy. So it's just important to be aware of that little piece of it.
Yeah, when I look at that, I always want to know too if it's GMO-free soy.
Oh yeah, I'm sure it is.
Yeah.
They're on top of their game, that company. So
yeah. I just switched over to Emerson Ecologics for my clients as the umbrella sort of for so many supplement companies, and I'm starting to use some products from New Chapter, as well as Designs for Health and so on. So so I love having the variety of choices that Emerson provides. there.
Yeah.
And it's also, the quality of the ingredients is so important, and being organic and sustainable and all that. So
right. Absolutely. And quality is such a huge issue. One of the things with encapsulated powdered herbs is that so frequently, especially if you have companies that are also tincturing or selling bulk herbs or whatever, most of the time they're scraping powder from the bottom of the barrel, right? And that's how they're, not all, like a brand like Designs for Health, Pure Encapsulations, Douglas Labs, a lot of them are, they're using other nutrients and stuff, but those are really high quality brands.
Right.
But if you're at Walmart and you're buying some black cohosh off a shelf in a giant bottle, it's probably not going to do you any good,
Right. So, well, I mean, Target was named in that scandal about fillers, as well as Walmart and GNC. So I just tell my clients that. I'm like, this is when it pays to go either, through a practitioner and we can order them, or to certainly ask what, brands we recommend, so that you're going to avoid those kind of situations.
Yeah, in the long run, trying to save money on herbs and supplements doesn't save you any money. You're just, I think, wasting your money a lot of the time if you're not going for quality. So
absolutely.
Yeah.
So we talked about the tinctures and the teas. Are there any other forms of herbs? What about just cooking or putting them in recipes?
Yeah, so you can do that. Usually, when I'm thinking about trying to have an impact on something like hormone levels, the amount that you're going to use in a food dish is probably not going to be sufficient to create the strength of reaction that I'm looking for. So it can be supportive for sure, and I highly recommend using really good herbs and fresh herbs in a lot of your foods, even just using things like, turmeric, which can be really anti-inflammatory for the whole system. Right, a lot of these herbs have a lot of really good, herbs that you'll cook with have a lot of good antioxidant qualities and all of that. So certainly I'm a proponent of that, but I don't think that you're going to get a shift. You're not going to resolve hot flashes by, throwing some oregano or something into your tomato sauce or something that you're cooking. So
right. Yeah. So let's talk about, I think another common problem is vaginal dryness.
Yeah.
Because that's a direct result of loss of estrogen, correct?
Yeah, and there are a few things that we can talk about with regards to this and symptom management. Unfortunately, as we talk about things like hot flashes and night sweats, those usually happen for a period of a couple of years for most women, and may ebb and flow in terms of their severity. But typically, those will resolve as we progress further into menopause.
Yes.
Things like vaginal dryness tend to get worse and worse, right? Unfortunately. So I think it's a really big issue that warrants attention in a way that maybe it often doesn't get. And there are some things, as one of the things I know you and I were talking about in preparation for this is looking at times when using certain types of either over-the-counter or hormone replacement can be beneficial, and times when herbs can be beneficial. And depending upon the severity of the vaginal dryness a woman is experiencing, there are a few different things that can be really helpful. So one of the things that, just in terms of symptom relief care, Dr. Anna Kabecka has a cream called Jolva cream, which its primary constituent is DHEA. It's a topical cream that you use that sort of stimulates kind of more mucus production and lubrication, but also can kind of stimulate libido as well. So if a lot of women in menopause, perimenopause find their libido starts to drop too. So that can be really helpful from a relief care kind of perspective and something to just keep that area feeling a little bit more comfortable. And then there are some good herbs that I'll recommend for that sometimes too. So, kind of come back to, so it's interesting. I think of wild yam as being particularly good for that. It's also an herb that oftentimes it's very similar in structure to progesterone. Mm-hmm. So it can have a progesterone enhancing effect, but it's also very anti-inflammatory. So when I think about the vaginal dryness and then sometimes the pain that goes along with that and atrophy and all of that, the anti-inflammatory constituent with the progesterone support is somewhat helpful. I also think about an herb like marshmallow. So marshmallow is a great, it's a demulcent, lubricating herb for all of the mucosal tissues, but interestingly, it tends to be more impactful on the urinary and genital tissues, whereas something like slippery elm tends to be more beneficial to the GI tract. So they're very similar in a lot of ways, but they direct themselves to different areas for whatever reason I'm not sure of. But so marshmallow can be a really great one. There's also an herb called lady's mantle, which is very tonifying for the vaginal lining and tissues. It's also an astringent, so it can sometimes be, the astringent quality can create a little bit more dryness sometimes, but the toning quality of it is really beneficial. So I wouldn't take it on its own. I would take it with something like marshmallow and wild yam, right? So you just want to make sure that you're getting the benefits of that, but that you're balancing it out where it might be having an exacerbating effect.
Mm-hmm. And when you say wild yam, you're talking about an herb, not the yam.
Yeah. So, and quite often it's been a little bit molecularly changed so that it looks more like progesterone. And typically you can find it in a bulk herb form. You can find it in a tincture. You may, a lot of times you'll also find it encapsulated in that. And you'll find it almost always if you see just a generic female hormone supportive blend or something like that. It's one of the most common ones that you'll see.
Mm-hmm. So this would be, in terms of ingesting it, you would do
right.
A tincture is what you're saying, correct?
Yeah, okay. Yeah. So that you can really try to enhance, what the body's doing internally, but then you can also use, topical external applications of things as well.
Mm-hmm. Mm-hmm. Yeah, I think this is very important because, most people want to have a sex life. And your body really does go through these changes that really impact, I think, your sex life, and so it can become a source of some anxiety if you don't know what the best remedy is for it and how to do it without side effects, because a typical GYN, a conventional approach, is to often prescribe hormone replacement therapy if you start to complain about this or bring it up. And I'm 60 now, so I've already gone through all this.
Right.
and it's that's still what the dryness is still an issue for me. As you pointed out, it doesn't get better. It just, continues.
Right. Yeah.
So this is an area I've explored a bit myself, and I have found that the natural approach does work, and but I've done it more topically, using more lubricants, natural lubricants. Mm-hmm. But I would be interested in trying this other issue because it is not just, frankly, the vaginal, cavity. It's the tissues around there that are also impacted. So I think understanding this sort of anatomically, as well as the herbal and topical side, what your options are basically.
Right.
Is key.
Yeah. And I think, you mentioned that oftentimes people will be prescribed hormone replacement therapy. And, I would say it's about 50-50 what I've noticed with clients who approach their doctors about that. whether the doctors actually even check the hormone levels or not. Some will check them first and then medicate and monitor and that kind of thing, and some will just prescribe, which I find somewhat shocking, but but it does seem to happen with a fair degree of frequency. And so I think it's just knowing, like, there may be times and places where that's beneficial and warranted, but I always encourage my clients who are on hormone replacement, if they're not being tracked and monitored properly, I strongly recommend that they take control of that with their doctors and demand that they be monitored properly. So.
Right, and the dose matters, as I recall. I mean, I had that discussion because I'm really careful when it comes to any kind of medication. And so I think what we agreed on was like the lowest dose that could still be beneficial. But it was also, frankly, rather expensive. And so I just I experimented with the natural lubricants and, frankly, the right partner, and it was fine. So I think sort of my general philosophy is try the natural approach first. Yeah, for sure. If you're at a point where you have the opportunity to try some natural approaches before diving into hormones and medications, absolutely do it. I have a really dear friend who, she's 71 now, and she had been put on hormone replacement when she first went through menopause. And then it was about 2 years ago when she really decided she wanted to come off of the hormone replacement. And this woman, she's the most balanced, equanimous, even-keeled, happy but not like exuberant, but just steady person that I've ever known. And when she tried to come off of the hormone replacement, she was walking around, she kept saying, "I'm so sad. I can't believe how sad I am," and kind of went through this numb feeling period too. And so just kind of being aware of how much of an impact that can have in so many different realms, especially if you think it's something that you might not want to do forever. Or just one of the reasons she decided she wanted to come off was because she'd had a breast cancer scare. It turned out to be okay, but certainly a lot of those hormones can, especially taking estrogen, can influence breast cancer risk and ovarian cancer risk and that kind of thing. So right, exactly. So we've talked a little bit in our pre-interview conversation about bioidentical hormone replacement. So I know just from preparing for the estrogen dominance episode that was an option that Dr. Christiane Northrup presented, and I was wondering whether you can tease out, when do you recommend that, something over the counter versus the herbs? Yeah,
so I'll just talk about one client who I have right now who's 48, and she's already effectively in menopause. She hasn't had a period for a couple of years now, and she's been a vegan for probably 25 years, and her gut is a disaster. I mean, she can hardly eat anything. She's reacting to everything, and she won't eat animal products. It's a huge ethical issue for her. So it's not like she's just going, "Oh, this is what I think is healthy." It's really like emotionally devastating for her to eat animal products. So I recognize that that's a real predicament, because she would probably do well with integrating some animal protein at this point, given how deficient she is across the board. But I also recognize that this is a spiritual, emotional, mental issue that can be troublesome for her. So anyway, she is so depleted and so incapable of absorbing nutrients. She's about 5'8" and 105 pounds or something like that. I mean, really malnourished, early menopause, right? So in her case, she came to me and she said, "Well, I've already started taking some hormone replacement therapy because I was just feeling so terrible and had so many symptoms. And she asked me, what do you think about that? She wanted my opinion on that. And I said, looking at you and looking at your history, I'm glad you're taking that because she's so deficient. There's no way, there's so much work that we have to do to restore her overall gut health so that she can absorb nutrients again and absorb all the building blocks that she needs for her body to even be able to produce hormones.
Right.
That I think that her using the hormone replacement in the interim is going to help her best be able to like muster the energy and the wherewithal and the emotional reserves and all of that to help her kind of go through what she's going to need to go through to rebuild her gut in a way that can then support building hormones and all of that and integrating nutrients. And so there's a long journey ahead for her, but that is a case where I was glad she was already taking hormone replacement.
Right. It sounds like, though, that would probably be an exception.
Yeah, well, certainly. So with most of my clients who come to me, you know, and a lot of them will come to me, you know, 50 years old, you know, perimenopausal, irregular periods, hot flashes and all of that. And they'll ask me, what do you think? And I say, well, let's try some herbs first, right? And we'll run some labs, we'll give it 6 months. Well, and then it's also so frequently about looking at what else is going on, right? Because for most women, certainly we're all going to have changes in terms of how we're feeling and how perimenopause and menopause impact us and all of that, and there will be symptoms. But if there are multiple other factors in terms of imbalances in the body, imbalances in your lifestyle and all of that, it will make it worse. And so if we introduce some herbs, try to balance out the hormones, and then clear up those other things, oftentimes the hormone replacement question is easily put aside after 6 months, 9 months of really focusing on those other things.
Mm-hmm. So if someone came to you with estrogen dominance, I mean, you've determined that, would you recommend a bioidentical progesterone replacement?
So I wouldn't be opposed to it. Certainly, I think that in terms of using bioidentical hormone replacement, progesterone is probably the safest one you could use. But you could also initially try doing something like Vitex and some other herbs and trying to bring down some of the estrogen dominance. So using things like Dimpro, oftentimes calcium D-glucarate, which, you know, and then I start looking for other things that might be driving estrogen dominance, like elevated levels of beta-glucuronidase, which oftentimes is driven by imbalanced gut bacteria, right? So there could be a lot of other pieces of the picture that need to be brought into looking at what's driving estrogen dominance, rather than just going, well, there's estrogen dominance, let's throw some progesterone at it, right?
Right.
So I would think about it from those, you know, ways to bring down estrogen. Also detoxification. So high levels of circulating estrogen could be because the liver is stagnant and not clearing them out properly. So sometimes supporting the liver, removing toxic elements from the environment, toxic foods, that kind of thing, right, can really help shift estrogen dominance. Mm-hmm. So I always work on all those fronts first, if I have the opportunity to.
Mm-hmm. No, that sounds really like the right approach, a holistic, comprehensive kind of approach.
Yeah, yeah. Mm-hmm. The more I do this work, the more I'm convinced that we can't look at one piece of the picture isolated from the whole. We just can't, because it's this just complex, integrated set of systems that we have that are interacting with each other in so many different ways. So I really think we need to always keep that in mind.
Yeah, and I think the good thing here is, the good news for people is you can do it naturally, you know, most of the time. And,
yeah. And
really, you know, to think about that first. And then, as we were saying, you can always try these other things too.
Yeah. Yeah. You always know you have those other options. And I think that's one of the nice things. It's like, you know that, okay, I can give this some time to work, and if it doesn't have the impact that I'm hoping for, you still have the option, hormone replacement or other things to deal with that, you know. So it's there's no harm in trying, for sure, right? So
Right.
even when I work with people with gut infections and that kind of thing, it's like, well, there are these great herbs that you can try, and if they don't work, you still have the option of doing antibiotics at some point, right? But if most of the time we can get it with the herbs, let's do that, and there's less collateral damage. So
Right, exactly.
Yeah.
It sounds like you clean up their gut and you know, help them with these other areas, probably a better diet and so on anyway.
Right. Yeah. Yeah. I mean, it's a multi-pronged endeavor, right? Looking at diet, looking at lifestyle, looking at
stress,
supplementation, sleep, hygiene, exercise habits, right? All those different things.
Exactly. Well, thank you so much, Ann, for sharing
you're
this
so welcome.
information with us today, and I will list some of the resources we've talked about in the show notes. So, listeners, the next topic will be how to choose the best exercise after age 40 with noted fitness professional Deborah Atkinson. So stay tuned for that and have a great, healthy week.